And I really appreciate the invitation, and especially at a quality council event. I think you'd be interested to know that physicians now are taking a huge interest in quality as one of its priority issues, and we as a medical association are really getting involved with the quality councils across the country, so I think it's great to be at this particular event. We are running I, like a lot of you, like to stay on schedule. We're probably already a few minutes behind, so I'll be going fairly fast. In addition to what AJ referenced about the slides, I'll also be putting slides up on my own SlideShare account. So if you miss a reference or if you miss a link or a URL, you'll be able to get it off there. Frankly, I'd rather be down there because I tweet these meetings. I'm not used to speaking them. And it's really hard to tweet when you're speaking as well. It's also really hard to watch the tweet feed there, speak, want to rebut what's being said there, and speak at the same time. We haven't really perfected that until we get it built neurologically into our systems, and one of the next steps, I'm sure. So what I want to talk to you today about is doctors and social media. Not, as we all know, doctors aren't the only players in healthcare. They're not even necessarily the most important providers at a lot of time, but frankly, that's what I know. There's a lot of interest in this field, and I think I can probably bring you a little bit of an update of what's going on in this area. And a lot of this is my take, but I'm very lucky in being able to monitor what's going on both in Canada and around the world with doctors and other healthcare providers and social media in healthcare. So I'm hoping that perspective will give you a little bit of a value to this presentation. Just a quick agenda of what I hope to go through, what we know about doctors and social media, why your own doctor probably isn't using social media but may want to consider it. I want to give you a few champions, people who are my heroes in this field. There's a number of them out there, but I want to just run through a few. What not just the CMA is doing, but other associations like the British Columbia Medical Association is doing in this area, and then finish quickly with a few other resources you may find useful. Introduction, the Canadian Medical Association. I hope a lot of you have heard of us, and don't mistake us for the Country Music Awards, which is what happens when you put it into Google. We are a volunteer national organization of Canadian physicians. We have about 75,000 members, which represents the vast majority of practicing physicians in Canada. Two main goals. One is to help sort of advocate for physicians, but the other is to advocate for a better healthcare system for the public. So it very much is a twin goal that we have here, and as you know, we are based in Ottawa. What do we know about doctors and social media? This slide, I don't want anybody to be reading too carefully because I lifted it from somewhere else. It does not have to do with healthcare, but it was intended to represent a very confusing graph because, frankly, the hard data on physicians and use of social media is lacking. There are not good statistics, even in the US, about what doctors are using social media, what types of social media they're using, and how frequently. You do see little snippets from sort of selected populations that say 80% of physicians are using mobile devices. 90% of them are interacting with their patients in the social media space, or they're downloading 2 million videos to YouTube a month. And some of those statistics are probably accurate, but there's no coherence to all of them. There's no real rigor behind the statistics. And it's even less so. Other healthcare providers as well. This is hot off Twitter. I updated my slide presentation twice in the last 3 days because one of the great advantages of Twitter is the ability to link with data sources around the world and get linkages to really good new data. This one is, I said, hot off Twitter. It was a survey conducted by Deloitte in the US last year, 307 physicians. And they report 6% are using social networks to communicate with their patients, which is an interesting statistic. I think it's probably high, and it's probably representing the US, so it's a lot lower in Canada, but it's showing 2 years ago it probably would have been 1%. So it's when I'm talking about a prognosis for this, that's going to be one of my key takeaways, that this whole area is definitely growing in how physicians are seeing the potential to engage more with their patients and improve health through use of social media. The best data we've had as an association is we have a group that we call an e-panel. It's volunteer doctors who've signed up and volunteered to answer questions on a regular basis about various issues to give us a quick take on things. I did this one the beginning of 2010, end of 2009. And here again, it shouldn't be a surprise that 80% of those we polled, they believe social media poses legal and professional risks to them, which is one of the, when we talk about barriers, this is probably one of the most fundamental ones. And that's not necessarily a bad thing, because they're concerned about their patients, protection of patient privacy, and how do we work that effectively. They did say that 1% of them say they're using Facebook in their practices for some reasons. 11% said they're using Twitter, and 22% said they're using other social networking sites for professional purposes. Frankly, I don't think this is representative of the profession. I think we had people respond to this survey who know what social media is and responded, because I can almost guarantee you that 1 in 10 doctors aren't using Twitter professionally out there in Canada right now. There are some people who are using it very effectively, and there are some good networks of doctors growing, but it's nowhere near 11%. Just quickly, a couple of comments we got from the panel on demonstrating. We got dozens and dozens of written-in comments when we asked these questions. The top one is on the negative side, saying that given the concern about privacy issues, social media in a physician-patient relationship is a dangerous trap best to be avoided. We got a number of these. We did get a few on the other side, though, which was heartening, saying social media is very important to us and should be harnessed. I greatly welcome this for patient-patient and physician-physician interaction. There again, you'll notice they weren't saying patient-physician interaction, but they were acknowledging where there may be places that social media can support what we're doing here. Why your doctor is probably not using social media. Key points: time, money, the regulatory environment that physicians need to operate in, their lack of knowledge about the technology, and the lack of proven clinical benefit. If we're talking about evidence-based medicine, even when it comes to electronic medical records, which isn't our topic today, we really don't have the good clinical data linking social media to outcomes, and that's going to be a key point to get to. I'll come back to all of these points quickly in a little bit. Why they're probably not using social media. Doctors are very sensitive. They're a self-regulated profession. They like to stay that way. They're regulated by licensed authorities in every jurisdiction, and they have to protect the privacy of the data of the patients they're dealing with. And the regulatory environment is, don't share this information unless you really need to in the circle of care to help the care of an individual patient. And by many definitions, a lot of our social media tools don't fit into that. And so they are quite concerned in that area. Here's an interesting, this is sort of the most hardline take I've seen on it. Not every college across the country has statements or viewpoints on social media, but this came out from New Brunswick last year, and it effectively says, our college doesn't see any good reason a doctor should be using Facebook, at least professionally. And that's pretty definitive. And if you're a doctor in New Brunswick and you use Facebook, you could find yourself up before disciplinary action if you use Facebook, I would say. So that makes it tough to want to experiment or want to use these tools. And that's the regulatory environment. It's there to protect patients, and I think it's a good thing, but it's one of the barriers that we're having to deal with. And I think it's heartening in presentations I'm hearing from medical students and residents that they're acknowledging that. They are very focused on professionalism, and they are quite committed to the regulatory environment, but they still see a way of using social media. By the way, the BC College of Physicians and Surgeons was a leader in this field. They came out with guidelines for physicians at the beginning of 2010. They're probably the best and most comprehensive in Canada, but they essentially say, don't get involved All the statements are cautionary. They're saying you really leave yourself open if you start using these networks and these tools. But from the perspective of the regulatory authority, that's what they're supposed to do, and they're a good set of guidelines. But it's why, going forward, we at the CMA thought we needed a more balanced guidelines that represent both the positive and negative challenges of social media, and I'll be talking to that later in much more detail in the workshop. The Canadian Medical Protective Association are the group that give the doctors their malpractice insurance and coverage. Their statements are basically saying, we'd rather you didn't. You know, you can leave yourself at risk for various things if you do this, but if you do it, here's a number of things you want to look out for. Once again, it's a barrier for physicians. But for your everyday doctor and individual practice, if you're looking after patients, you don't have enough time in the day for your patients anyway, and you're spending all evening writing up your notes. You just don't have time to go on Twitter or time to develop a good Facebook page to educate patients about immunization. You're just too busy. Second point, they don't get paid for it. And we all like to get paid for what we do. I mean, this isn't money grubbing on doctors' parts. This is just they want to be remunerated for things that they're doing professionally. And there are very few doctors in North America who are getting paid to be on social media. I'll touch on one at the end of this. They don't understand the technology, and what they've heard about Facebook and Twitter doesn't exactly encourage them. They hear all the horror stories in the papers about inadvertent lapses in patient records, these things about people going on, posting pictures on YouTube of patients while they're unconscious in the operating room. These things happen. Nurses making derogatory comments about patients on their Facebook page. They hear the horror stories and see people getting disciplined about this, so they're not really hearing a lot about the positive upsides about social media. And as I touched on right at the start, they don't see how it can be used necessarily to improve the care they deliver. Why they should consider using social media. Hopefully I think this is probably one of my key slides and one of maybe the takeaways for you and the groups you're working with. It's generally acknowledged that social media is a great tool to communicate more effectively with groups of patients or the public. If you want to get correct messages out there around general issues, and the reach of social media is phenomenal. It goes around the world. And it's great that a doctor, if you care, can get these messages out more effectively on social media. Just as a physician, it's great for staying better informed and up to date about medical or health developments. You can probably get updates from peer-reviewed medical journals quicker through Twitter than you can from any of the other feeds you're getting as a practicing physician. That's one of the main reasons I'm personally on Twitter, is I get linkages to the medical journals, to other people's blogs, links to links about a lot of data that I just can't keep up with in any other format. So I think that's a huge potential plus for a practicing physician. There's a huge potential to exchange information with their peers on a secure network. If you've got a secure network for doctors only and you can share general case studies, generic information, exchange your own best practices, there's a lot of that going on. There's a huge uptake in use of social media for continuing medical education now, continuing professional development across the health professions. This is a really growing field, and it's one I think has got a huge potential. Monitoring public health trends. There's someone you may know called Gunther Eisenbach in Toronto who's done some phenomenal work about using Twitter feeds to monitor H1N1 trending a few years back. People are using Facebook to track flu trend, or Google even to track Facebook or flu trends quicker than the other public health tools that are available. So social media has a huge potential here in public health. And to conduct medical research. There are doctors who are using this to gather data to recruit patients. It's got huge patient recruitment potential for clinical trials. There are others that are probably going a little bit beyond the pale. There are two GPs in the Netherlands who use Twitter for primary care. They invited people actually to use a Twitter feed for primary care, and they found it worked. They didn't get, patients of course weren't going to discuss very personal, discrete issues with them, but they put the doctor on notice that they wanted to talk in more detail at another time. They got people who weren't their patients sending in notes,
And they found it a very educational tool, no legal repercussions, no lawsuits or anything. It was an interesting little pilot experiment. They didn't get paid for it. They didn't continue it. But if you're looking for that reference, it's a very interesting little case study. The most important thing probably is for communicating with and engaging with patients. And there's a number of ways doctors can do that. They can write their own blog to update people on health information. There's a real need to correct a lot of erroneous information that's online. It's sort of often the debates online and some of the social media go to the lowest common denominator. And we have some huge amount of factually inaccurate information that physicians, if they want to, can go in and help correct or help to provide some balance on. Posting videos on YouTube is a great way of informing people about certain procedures. I know doctors in the US who are especially in specialties like dermatology, plastic surgery, who are using it to show a patient what's involved in a procedure. It's a great educational tool. They can use it to start a Twitter account to tweet from medical conferences, much as we're doing here. I was at a conference 2 weeks ago in Vegas called HIMSS, which is all around electronic medical records. It hit a world record for most tweets from a single medical health conference in a day. There were about 4,000. So it's a huge potential to give your perspective on what's going on at a conference. And if you're a doctor at a clinical conference, other doctors will read that, patients will read it, and it's a good discussion about what you're hearing about from a medical meeting that otherwise you'd have to wait for it to be written up in the medical post or for that data to show up in a peer-reviewed journal. And if you're really ambitious, you can moderate a patient community discussion. There are social networking groups just for patients, and they quite often welcome physicians in to moderate some of the discussions. This is a fairly high-risk procedure or high-risk thing for a doctor to do unless they're involved with a healthcare institution, have some recognition, have them willing to pick up the risk. But it is definitely something they could consider. I'm getting down to a couple of minutes, and this was probably started when AJ started, I'm assuming. So I'm going to just try and run through my other slides as quickly as I can without becoming incoherent. We have a waiting room magazine for doctors, or for patients, called Canadian Health. And next, in a coming issue, our president had this to say about social media, just to let you know where the CMA is coming from. And it's basically our balanced approach, saying that as a profession, doctors are just coming to understand how social media helps us doctors interact and communicate better and engage in conversations about health and deliver messages about better health. And he says, don't expect your doctor to be your friend on Facebook, but don't be surprised as you see more and more doctors using these social media tools in ways that can help make everybody's health better. That's our perspective as a medical association, and that's the message we're trying to relay to our members. I don't know if any of you know Dr. Lapakis, formerly from ISIS, now at St. Mike's Hospital in Toronto. A very good perspective on how social media needs to be used to help us improve the healthcare system by having leaders and the public work together. That's just to show that academic medicine, to a degree, is on site here as well. Quickly, my physician champions. Some of you may know Dr. Alan Brookstone, a Richmond-based BC physician who was one of the first people to use sort of audio presentations and blogs to tell doctors about EMRs. And he's still doing that. He's got a website called Canadian EMR, which is probably the best, most informative site for doctors working with electronic medical records. Dr. Brian Goldman, CBC's White Coat Black Art, very much uses social media in what he's doing with doctors and the public in order to get new topics, in order to gauge people with his blog. Very active on Twitter and very active on other social media sites. Mike Evans, he's a family physician in Toronto who just recently went viral with a YouTube video he put up working with some very innovative folks about what's the one thing if you had to do one thing to improve your health, what would it be? And he's put out a very neat video on the value of exercise. It's got more than 2 million hits now in the last 3 months. It's getting incredible pickup, and it's how a physician is using these tools effectively to get out a great message and get that message out effectively. Anne-Marie Cunningham, you probably don't know. She's a Cardiff, Wales GP who is very outspoken over there, a leader on Twitter and blogging. Last fall, she hit the newspapers in England when she saw some really anti-women comments that doctors were making in the maternity wards, sort of calling them labia wards, being very negative against pregnant women. And she went on her blog and she called these doctors on it. Got into a huge debate because some people tried to flame her out about this, saying this is all just doctors among themselves, you know, get a life, we're not being offensive. And she said, no, this is wrong, this is hurting patient care. And she was a real lead in that, and that's the sort of things she comes out with. Dr. Wendy Sue Swanson, Seattle Mama Doc. I don't know if any of you know her yet, but she's a Seattle-based doctor who is actually paid to have a blog about pediatric issues. Hugely popular and very informative, very educational for the public. A couple of e-patients. I don't know if you know about the whole e-patient movement. This is engaged patients who are using online tools to really make a difference. This is Dave Bronkert, who's known as one of the leaders and founders. He had stage 4 kidney cancer, I think, couldn't get his medical records from the hospital, and, you know, said, give me my damn data. That's what he lives by, and he's become a real leader in the movement of engaging patients in their health care. I met Regina Halliday at the conference in Vegas I was referencing. Her husband died tragically in hospital. She couldn't get the information she needed from the hospitals. She's gone very public with that. She also paints on jackets stories about people's issues with the healthcare system. Incredible story. She's an incredible advocate and just another of my heroes. I'll skip over this. The BCMA was one of the first.
So in terms of using social media and healthcare, how would we rate on a sort of global scale? Like upper 10, lower 10, the data isn't there?
You mean healthcare in general or BC in general?
Canadian healthcare, not within the provinces, but nationally.
Canadian healthcare isn't as advanced as the US because some are building. Physicians are competitive in the US. They're seeking new patients. They're making better use of social media to do that. And in that way, they're advancing the whole field. Europe is quite far advanced, but we're probably on a par with most European nations. We're not doing badly, but this is, you've really got to, we're talking to the converted and preaching to the converted in a room like this. A lot of people don't have a clue about social media or how to use it to improve healthcare. So Canada is really no worse than any other nation, and I think the US is a bit ahead of us just because of the e-patient movement and the way physicians are using it from a, I'll get business to my practice.
Hey everyone, I'm here at the back. My name's Kevin. I'm our digital media and communications specialist here at the council. First off, good job with the tweeting. I'm having a hard time keeping up with everyone. I've got a question from Twitter, from the user eHealth Musings. He's following us from Ontario, both on Twitter and our Cover It Live. And his question is, he's wondering about the criticisms of CMA social media policy, that it's too negative, and he's wondering if you can get your thoughts on that.
Well, he's obviously mistaken and thinking about the American Medical Association social media guidelines. No, I'm serious, actually. The AMA published their guidelines about 1.5 years ago. It was 3/4 of the page. It was extremely critical and got a lot of negative feedback. If we are getting negative feedback about our guidelines, I apologize for that. But if we were to recommend that all of our doctors go out and set up Facebook pages right now, we'd be leaving them hugely at risk from a regulatory, disciplinary, and malpractice perspective. So what we've tried to do is provide a balance, and that's as far as we can go. We actually consulted with the Medical Protective Association and the licensing authorities, and that was we tried to be as positive as we possibly could in the context. So I can hear people making that criticism, but unfortunately, as an association that speaks for a number of doctors, we couldn't go out and say, go out and use social media because it's the best thing since sliced bread. Yeah.
Hi, my name is Jocelyn, and I'm Research Girl CA on Twitter. I'm a researcher, a health researcher, and I'm also sort of a professional patient. So I wear both hats, but I'm curious whether, since social media has been sort of gradually taken up by physicians, whether perceptions of patients using social media to communicate about their health and their questions have changed among physicians. Because my perception has been that generally physicians resent patients talking about them or about their work or about those health conditions online.
I may be overly optimistic. I think things have changed. We actually did a bit of survey work about this, and a lot of doctors are starting to recommend websites to their patients. They are not resentful of patients coming in with, you know, the old story of patients coming in with this much of a printout off the websites. That doesn't really happen, and you know, you may not believe it, but doctors really do want to engage in patients around discussions around that patient's health. Their problems are time constraints, and nobody wants to be a doctor who says you have 5 minutes, you're allowed to give me one issue, and that's all you can talk about, because we know with chronic diseases that doesn't work. So doctors are becoming more receptive of having in-depth discussions with patients, and good doctors are never resentful of patients having a lot of information and wanting to discuss their issues in depth. Like any other profession, like any other group of humans in the world, there are the arrogant bastards out there, if you'll excuse the expression, who think they are still God's gift to the world. But I really truly think that's not representative of the medical profession today, especially the younger residents and students that I'm talking to.
Hi, I'm Michelle, and I'm here with Hello Cool World. And I was wondering, is there anything happening in medical schools around education in social media for doctors who are being trained now? And related to that, is it something you see younger doctors using more? Or?
To answer your second point, there's definitely a demographic difference here. All young doctors are using social media because they're using social media in their personal lives. Every medical school class has its own Facebook page. They're growing up using social media, and they're interested in using it professionally. So there's definitely that. They are starting to get some education about this. It's mainly under the titles of professionalism. When they get classes on professionalism, I've heard from the students and residents that the professors are starting to bring up issues about using social media responsibly. As far as I know, the only specific course dealing with social media for physicians was developed by a Hungarian physician. It's in English. He's making it freely available. He's another of my heroes I didn't put up here, and I can give you the linkage to that. But he's actually developed a course for teaching medical students about social media.
Hello, I'm Robin Cecil. I'm working on a number of projects that are targeting doctors, general practitioners, and specialists. You put a bunch of barriers up to us communicating with them: time, money, education, the whole privacy thing. I was just wondering from your perspective, is that if we could solve some of the privacy education issues, would we ever solve the time-money issue short of a billing code for social media?
I think we may start to solve the time-money issue with the new primary care models. When you're moving away from fee-for-service and you're getting into dealing with more chronic diseases, there's a lot of new tools out there. They're sort of bells and whistles tools where doctors are encouraging patients to enter their data remotely, and that's getting them more used to using good, innovative tools to deal with their patients. I think the new models, if the current recession doesn't shut these down because governments are going to go back to cutting off the money for doctors, I think we're going to see doctors getting more time to investigate these, and as they become more comfortable with social media, they'll be much more happy to use those tools to communicate with their patients, I think. Here again, that's just my personal take.
We'll take one more question, so make sure it's a good one. Okay, it doesn't have to be good. I just shut everyone down.
If no more anyway, thank you very much for being patient. I'm sorry I rushed through things, but I'm hoping I got AJ back on track.
No, it's great, and a really good topic. Thanks so much, Pat Rich, for doing that.